Case one is a 21-year-old woman. She is a professional international soccer or football player. And she comes to my outpatient department because she has heavy menstrual bleeding. And this bothers her every month, especially when she has a match going on. I see this problem very often, but you can also see this problem in female athletes. There are a few things I would like to know when they come to my clinic. The first thing is, is the menstrual cycle regular, and how much is the amount of blood loss? We know that a lot of women think they do lose a lot of blood, but still in the end it's only like 50 to 100 mils of blood loss, which is normal. I always ask for abdominal pain during the menstrual cycle, which is called dysmenorrhea, and of course a history. And this history is also needs to include questions about bleeding itself. So, for example, did you ever went to the dentist and had a longer bleeding period, for example? Contraceptives do have an influence on the menstrual cycle. So I really wanted to know how much blood loss you have. Do you use any contraceptive medication? Do you have a Mirena IUD or other IUDs? And also very important, what do you prefer? And the last question is if this heavy bleeding will cause anemia. Since you can maybe imagine that if your bleeding is that heavy that every month your hemoglobin will go 1 point lower, it will influence your performance in your matches and even in normal training activities. Kirsty is going to tell you a bit more about the background.
Thanks, Emma. So I'm just going to share with you some ideas now around some of the supporting research, or how we could research more into these topics. So when it comes to heavy menstrual bleeding, we actually don't have a lot of research around the effects of heavy menstrual bleeding on performance, especially in football, but actually in general in any type of women's sport. And this is for a number of reasons. So, for example, as Emma said, it's really important to know the volume of blood loss. And actually, we find that with some players that we've worked with and tried to do some research with, that they don't actually know what is normal. And so you can imagine, if this is not a topic that's being discussed openly within football clubs, then your point of reference, the player's point of reference is their own experience. So determining what is normal and what is heavy can be difficult for them. So we need to, of course, then change the conversation and raise awareness and educate around this topic. So from a research perspective, it can be very difficult to recruit participants, players, to research studies because they don't always know whether or not they have heavy menstrual bleeding. We also find it difficult because if we go to work with clubs and we want to do some research and understand this topic more, it's sometimes that the player hasn't reported it to the club. So maybe they know they have heavy menstrual bleeding, but they've been working on this issue with like a general practitioner, so the doctor they see away from football, away from the sport. And so maybe they don't know who within the club to speak to about it. So again, when we go in there to work with the players, to do some research, to understand how this might be affecting the players and performance, we don't know who to get this information from. We also need to understand, like Emma said, how is this being managed? So is there any type of medication or supplementation? Because again, from a research perspective, if you want to look at the effects of heavy menstrual bleeding, say on football performance, it may well be that we can identify some people with this condition, but if they're being medicated already or they're doing some type of intervention, it may then exclude them from the research. So actually it acts as a confounding factor. In terms of, I guess, some of the more practical implications within the club environment, so not specific just to the research environment, of course, players with heavy menstrual bleeding will need to consider things like uniform. I know, for example, certainly in the UK where I'm based, there's been a lot of conversations recently around players having to wear white shorts. I think, of course, this may cause some anxiety for any female player who menstruates, but particularly for those who maybe are suffering from heavy menstrual bleeding. So there might be some considerations around uniform. Of course, ideally, we want them to come forward and speak with doctors and work with people like Emma so that they're getting treatment for the problem, rather than just saying, let's put every female player in black shorts and hide the problem. So we have to think carefully about the issues around uniforms, whether or not we're helping in the long term or just in the short term. Maybe some other practical implications more within a club setting is around the availability of menstrual products. So, of course, those players who are suffering from heavy menstrual bleeding may need different products. They might have a preference for different type of products. And again, are these being provided within the club setting? Or if they need to change their products more frequently, what happens if they run out of the products they've taken, say, with them from their own homes? So making sure that these products are available within the club setting will be quite important. And then even things like practical things like how often they need or get a toilet break. So again, thinking about that culture of who might know within the club that a player has heavy menstrual bleeding. Is that something that's built into the club environment? So how often are they offered a toilet break? Can they go without too much disruption to the training session and so on? And then maybe some practical considerations directly for research. As I've said already, that it can be difficult to recruit some of these players. So for example, if we want to study heavy menstrual bleeding, it means we need to collaborate with a lot of clubs because there won't be sufficient players within one club to do a study. So in order to get maybe even a sample size of 10 players with heavy menstrual bleeding, it means that researchers may need to go even to 10 clubs to get one player per club, for example. So recruitment can be difficult. And also when we think about maybe studying the effects of heavy menstrual bleeding on performance within football, we might actually question ourselves and say, well, instead of studying the effects of this on performance, do we not have a duty of care to make sure that actually that we work with those players so that they have their heavy menstrual bleeding is well managed, they have the right medication, the right products. And actually, if we have the duty of care really correct and right, then perhaps there won't be any effects of heavy menstrual bleeding on performance. So quite a few practical things there to consider about, I guess, from the player's perspective, the club's perspective, and from quite a specific research perspective. I do want to share one research example with you. So this is a survey. It's not specifically from football, but it is from elite women athletes. This survey conducted in 2020, so quite recently. Of course, with surveys within research, there are sometimes some considerations that we need to acknowledge. So, for example, there may be some bias in the sampling, in the recruitment. So, again, if you're a player who with suspected heavy menstrual bleeding or with diagnosed heavy menstrual bleeding, you might be more likely to take part. And of course, in that sense, then we might inflate the numbers a little bit. So, thinking about surveys, some of the other things may be around the fact that it's often self-reported. So, maybe the conditions are described by the players themselves and are not confirmed by medical personnel. So just a couple of the quick considerations when we are considering survey data. But in this survey, they showed that amongst women athletes, that the athletes did seem to have a higher incidence of heavy menstrual bleeding when you compared them to their non-athlete controls. So women of a similar age who were not engaged within elite sport. Some other findings which I think are very interesting. So if they have more incidences of heavy menstrual bleeding within elite sport, what does that mean for performance? Well, they looked here at quality of life, so maybe more indirect measures of performance. And actually athletes were self-reporting, an important point, better physical quality of life, but actually they had higher perceived stress scale levels. So actually a worse mental quality of life. So actually two things there in opposition. And so we would need to think about, with these two things possibly in opposition, how does that manifest in any changes in performance? And actually this survey didn't go on to cover that, but it gives us a sense of that perhaps this is an issue that we need to look at the incidence rates in elite football in particular. So we have data sets directly for football, but then we need to think about, well, if there are changes in physical and or mental quality of life, do they manifest in changes in performance? So lastly, just to try and draw this together in terms of our case study, for sure, we need more high quality research. For a long time, when considering women, we said we needed more research, but actually we need to also consider the quality of research within this space. It can be difficult sometimes. For a long time, we've not researched women athletes. And so therefore, if we're not really embedding that in our, say, sports science degrees, then we're not actually really training the researchers of the future. So we really need to look at every aspect about research and how we train people in this space. So we need more high quality research. As you'll have heard from some of the, I guess, more practical side of it, we need this topic of heavy menstrual bleeding to be discussed openly within clubs. So for a long time now, we've been saying that the menstrual cycle is one of the remaining taboos within sport. I think this is no longer true. I am really feeling better about this topic. As I say, I've been in this area 25 years, and I think in the last 5 years, I've seen a real change in the culture. But of course, now that we're speaking about menstrual cycles more generally, we have to push now even further into some of these quite specific, maybe types of menstrual dysfunction. So if we can talk about it more openly, I think that will help. As Emma showed us, we definitely need to have some screening questions. We need to ask the right questions, and more than that, to have good follow-up questions to understand the whole environment. And we need to be able then, if we have a suspected case of heavy menstrual bleeding within a club with a particular pair, we need to know who to send them to. Coming together, that means that within the club environment, we need good resources. So whether that might be free sanitary products in the toilets, it could also be consideration around supplementation. I mentioned about anemia, for example. So it could be, or it should be, that we use a multidisciplinary approach to handling cases of heavy menstrual bleeding within elite women's football. And then we need to think about quality of life. That survey showed us that there could be changes in physical or mental quality of life, and how that then may affect the player's ability to perform. And when we speak about performance this evening, we're talking about both training performance, but also competitive performance. So Evert, I will hand back to you to maybe take some questions on this case study.
Yeah, sure. Thank you for this first case study. Very, very interesting. There is one question in the chat where I will get to quickly. I wanted to ask something. I heard some terms. What is normal? And then there was also the term dysfunction. And Kirsty, you said diagnosed somewhere, which makes me think there's a thin line between what is normal, heavy menstrual bleeding, and what is abnormal. When, this is a question for both of you, would you start to be worried where it becomes really an issue for the player?
Shall I start, Kirsty?
I think so.
We ask the patients, or the ones who come at my outpatient clinic, to fill in like a scoring list where I can see how much blood loss they have every day. And normally you see that the first 3 days of your menstruation, of your period, the blood loss can be a little bit more, and after that it gets less. A period can last for like 7 days. That's normal. And the mean blood loss is about 80 milliliters, which sounds not too much, but most of the time it's a lot of fluid you lose as well, but it's not full blood. But for sure, this is very difficult for patients or to see how much it is. So that's why we have a PBAC score, and this PBAC score gives me an indication of how much it is. But sometimes we just say, if you experience it's heavy, you need to do something about it. So also the experience, we need a combination of the amount of blood loss and the experience.
Okay, that's clear. Kirsty, you want to add something?
Yeah, well, I mean, of course, Emma is the clinical expert. I guess more within a club environment, as I say, it could be that some players have heavy menstrual bleeding, but are not sure. So of course, by the time they get to Emma, they're already thinking it's possible for them. So I guess within the club environment, the only thing to add is if we change the culture, if there's a willingness to discuss these topics, then we may find people with, or players with, heavy menstrual bleeding coming forward, and knowing who to speak to in the club. So, you know, who is the person they should go to. Some clubs, of course, have a clinician, a medic embedded within the club. Not all clubs, of course, depending on the facilities and resources. So it's just knowing that, you know, who should they speak to about this in the club? Are the players speaking about it to each other? And then just thinking about, you know, what's available to them. So somebody to speak to and get signposting to people like Emma, but also, again, what facilities they have to maybe deal with this issue. So they can, when they have a diagnosis, how do we make life better for them within the club setting?
Yeah. Okay. Thank you. One question in the chat also on this case, and then before we move to the next one, there's Jan van Asseldonk asks whether it's maybe, apart from awareness, also an option to give intravenous iron. Maybe this one is for you, Emma.
Yeah. Thank you so much for this question. You have various options for heavy menstrual bleeding treatments. In the first case, I want the bleeding to stop before we start giving supplements. So iron intravenous or by tablets is a possibility. We see a little bit more reaction when you put it in an IV drip, so intravenous. But that's an option we give to patients very often. Everything has its side effects. So in the first place, I think we need to cover why somebody's having this menstrual bleeding and treat what the reason is. So diagnose it and find the reason. And then if you want to get a quick iron transfusion, then this intravenous option is a very good one. Yeah.